if anybody asks me, a healthcare professional, on can you just elaborate on? Yes. So in fact, so how do you change? And so I always have told them, and my go-to line is that please join the. I mean, I would not do justice, and on behalf of the mentors who are really good at what they do. So I think I have always encouraged my colleagues to join the academy.
Thank you. Hello friends, welcome once again to the another episode of Hall of Fame interviews, in which today we have Dr. Dhaval Pandya. He's an endodontist and he has many specializations to his degrees, and he is a very successful practitioner last 16 years, and he is also imbibed and absorbed our academy knowledge, and he has taken a lot of advantage of that. So thank you for joining, Dhaval, and congratulations for the HF.
Thank you, sir.
So tell me about your childhood and your background, where you come from.
So my childhood has been from the city of Mumbai in Maharashtra.
Mumbai.
And yes, Dr. Sandesh Maikar. In fact, I've had the privilege of working with Dr. Sandesh Maikar, sir, on some of his implant patients.
Yeah.
So yes, so I think Dr. Sandesh Maikar, sir, is equivalent to cosmetic dentistry, and he's fondly known as a father of modern dentistry in India.
Yeah.
So I come from his city, and of course, then I completed my graduation, from Bangalore, from MS Ramaya Dental College, way back in 2001, after which I worked for about a year and a half, gained some experience, and then appeared for my postgraduate entrance exams. Subsequently, I completed my post-graduation in the subject of periodontology, which I finished from Maharashtra. And subsequently, I enrolled for a one-year fellowship program in implant dentistry, which was a structured program. This was in 2008-9. So 2008 onwards, I started having consulting practice, as I did not have my own clinic or practice. I was consulting, and my practice focus areas were periodontology and implant dentistry. I have seen a paradigm shift in terms of practice in the last decade or so, and subsequently in 2022, I came to know about the Doctorpreneur Academy, which was online, and I just happened to enroll it to learn something, and I think it was the best decision ever in the last 2 years. Each and every webinar from the starting point by Dr. Pranav and Dr. Amit, both, I ensured that I attended sincerely, barring a few webinars. And I think the most important webinar which helped our practice growth was the digital marketing and the Google SEO and ways of ethical marketing. I think that was this was very, very good. And subsequently, sorry, I forgot to mention that 2021, in the midst of the second pandemic wave, I started my own practice, where in fact there was a lot of decline in the dentistry practice scene at that time.
Right.
And so there was a lot of negative atmosphere everywhere in terms of our profession. And that's where I think in terms of our practice growth, a lot of learnings from the academy webinars is something what we stuck to as the guiding principles. And yes, I think it's about 2 years now since we started our practice, after about 18 years of consulting practice. But I think the growth, what we have seen, not only revenue wise, but overall growth in terms of professional work has been really good.
So it has been a great journey in the dentistry. And for last 3 years, you are having your own setup?
Yes, sir. Since September 2021, we started our practice, own office.
There are a lot of myths in dentistry, and people say that there's no scope and there's a lot of competition. And what is your take on that?
So, sir, I vividly remember some participant had, during our webinars with the academy, one participant had asked a similar question in medicine and dentistry. And one statement which Dr. Amit and you both had made, and which is so true, is that A professional just needs to polish his or her skills and know the right way with the changing times. I think if that these two things are done in the right way, I think there is still a lot of scope and growth for any individual or a practice.
Right, great. I wanted to hear it from you.
Thank you, sir.
So, Dhaval, tell me that what have been your learnings or what lessons which you learned in your long practice of consulting? How early you should start your own and how late you should start your own?
So I think in my personal example, sir, I took more than 10 years to start my own office, but I think a reasonable good time for any professional, healthcare professional to start their own practice should be about 3 to 5 years of work experience with some good hospital or good teams in their area of interest or specialization. And that should be a good time to quickly jump onto their own practice or starting their own hospital setup. Provided, as I was discussing with you, sir, the dynamics of practice in healthcare are changing very rapidly. So that needs to be taken into account, and that learning has to be imbibed as an ongoing process.
So what are the challenges that you face now, like when you once started your own setup and managerial issues and keeping the people intact, HR issues? What all has been your learning?
Yes. So, sir, so we having a very ethical and like a 13-point practice policy, which when we started as a group of specialists, the number one challenge was to get patients suitable to our area of work. So that was our number one challenge. And visibility, that was one thing on our top of our mind. So that I think has been overcome with a lot of academy webinar learnings. The second challenge was, of course, to get staff and having a good retention of the staff, and not making the staff not to be poached by the competitors. So this is, I think, one of the second big challenge which any healthcare office or a hospital sees. And the third aspect which I would highly put as a challenge is the attrition rate of the staff, and that also includes the doctors.
How do you manage that? How have you taken care for your staff not getting poached?
So we've developed a small SOP for any of our staff who get inducted. That includes our front office manager, our assistant staffs, and others. So one of the main factors for them is to engage them actively in a lot of decision making. Of course, except the treatment plans, not there. But apart from that, I think all the staff, we involve them in a lot of decision making. So making them a part of the entire team. Ownership and responsibility, and not just treating them as somebody. So for example, our front office staff exactly knows on any procedure, any patient being appointed for a procedure, she knows exactly on what procedure has to be done. If the family relatives of the patient, they inquire, if they ask, if they have questions, she is quite trained to make them understand on the nuances of the procedure. And SOP in terms of, the pre-operative checklists which have to be given to the patients, especially if there is a surgical procedure involved, and post-operative checklists. So that engaging them actively, I think makes a lot of difference in terms of going beyond their role as on what they do. For example, the front office staff is just not there to do the front office roles, but they also do allied ancillary other roles as well.
Very good. This was a very important point that has come in our discussion, that as a doctor, as a team leader, you should not keep the subordinates or these front office staff and other staff as just a chatbot. They're not chatbots. They are actually humans, and you should take their human angle into consideration by dealing with them, as well as take work out of them which are not conventional. So basically, they are your ambassadors. They can get you patients. They can market for you. They can vouch for you. They can give good opinions on the web, and as in the setup also, they can help multiple ways, like counseling and
absolutely. Yes, sir. And so sorry, but a second aspect which we feel is the ongoing training, which we ensure also not only for us as professionals, but also for the staff. So for example, recently one of our assistants wanted to be trained in assistance of a procedure. So we are ensuring that, they also get their level of training in the procedures they assist us. So that is something which keeps them actively involved and they look forward to the appointments of the day, and that's how the attrition rate we feel is lessened from the practice.
So if they feel that their future is also secure and they are also growing with the
Absolutely. Absolutely, sir.
Now coming on to other topics, your wife is also a dentist and you are also she is also practicing. Two of you are a group practice. Other doctors are also there.
Yes, sir. So my wife Purvi is an endodontist, and we have other team of specialists also, and that also includes a few medicine specialists where we routinely refer our patients when a systemic organ disease is involved.
So a polyclinic kind of a thing?
Not exactly polyclinic, so it is actually a specialty dental clinic, but then we refer these patients where we feel that there is a systemic organ disease. So for example, in my field, a periodontal disease in the gums, there is a link with systemic organ disease like hyperparathyroidism or parathyroid hormone. So then we refer them to an endocrinologist with a reasonable amount of experience, and so these are or an hematologist or an hematologist where we treat a lot of these syndrome patients where we have to look for their oral surgical procedure. So we've kept that model, sir.
How big is your setup?
So, sir, right now it is a one operatory since 2021. We started with one chair and one operatory. And now, sir, we are looking at expansion plans by this September.
So good. In 3 years only, you are now expanding.
Yes, sir.
Good. Great to hear that. So how long you have been in the academy?
Sir, it's about 1 year, 3 or 4 months. Sir.
How did you join us?
So, sir, it's very interesting because usually we undergo a lot of training online in my field. So I just came up across the academy as an online feed, and I was very curious to know on what the academy is all about. So I happened to click on the link, and obviously I saw the background of the academy, and I saw the mentors who were so well qualified with some background. I had no two doubts in my mind to join the academy. I was not really sure whether what is going to be my learning curve, but I think it was one of the best decisions in my professional continuing education to join the academy, because in terms of practice growth, it has helped us tremendously, sir.
So what are the main lessons learned for you from the academy?
So there are a couple of them, sir. It all started with, I think, the first introduction lecture when I was inducted as a life member on what are the traditional versus the modern ways. And so first thing, the mindset shift has to be very rapid in terms of the healthcare professional, that there is always going to be rapid shift in the way the healthcare profession is changing. That is one. And I remember this very clearly. Secondly, in terms of ethical marketing and growth, which we always felt that, or we were always told that, in ethical marketing, there is always going to be a plateau in terms of the growth. But I think with the academy showing us different ways on how practice growth can occur, I think that was a very important learning or takeaway for me and our team. The third aspect, sir, which I want to emphasize is the practice management. I think there was one webinar on practice management, on how practice management is an important aspect. And I think when we go to our dental or medical schools, I think that is not a part of the curriculum. So I think that was a very important webinar and take home learning for me as well as our team.
Has your colleagues or somebody from your friends have noticed that change in you after you have joined? Something like where you learned this from?
Yeah, so most of our team members, they were very curious. And in fact, I have always mentioned it to everybody about the academy, and to pass on the message to a lot of colleagues on the learnings.
That is what the feedback you usually get. Because there have been people who are saying that I took your course and then I taught around 10 people and they have their hospital. So that is a multiplicative effect is happening.
Yes. So in fact, if anybody asks me, a healthcare professional, on can you just elaborate on how do you change? And so I always have told them, and my go-to line is that please join the academy. I mean, I would not do justice, and on behalf of the mentors who are really good at what they do. So I think I have always encouraged my colleagues to join the academy.
So tell us about your digital journey and how online you grew and a website and all those things after joining.
Yes. So, sir, this is a very important aspect of our practice. We were not into the digital space at all, and we were into traditional word of mouth referrals of our patients. And I was not very sure. After attending the webinar from the academy, immediately I made the changes. And the first thing we did was, I think, the Google page SEO, which was the first thing. And we decided on embarking on our first digital site. So these two were on the priority, and as we started working towards it, we saw that it was really a great practice management tool. And I think, according to me, now in this day and age, any healthcare professional practicing needs to be on this digital space.
You are what Google says you are.
Of course, not everything.
Yeah.
As we always tell patients that you cannot. So when patients ask us also that we've learned this from Google, of course, we always tell them that no, unless it cannot be verified technically.
Yeah.
But as far as digital marketing is concerned, it's a different mindset now in terms of the population when they're looking out for any healthcare professional, unlike
Right.
the traditional way.
So what is your
Yes.
future plans?
And there was, I think, Amit sir's on the short, medium, and long-term goals. In fact, I've written a small note on our desk, and that, I keep that in my mind all the time. So our immediate medium-term goal was to see the growth from our existing practice. And as I mentioned to you, sir, that, by end of September 2024, we are looking at expansion of our practice.
Right.
And that is in terms of not only the operatory setup, but also in terms of having all the gamuts of instrumentation and other dental materials used for treating or opining on complex dental pathologies. That is our medium term goal.
Other than practice, what are your choices? I mean, in hobbies or something? Spend time in the family and any games, sports
Yes,
you
sir.
play?
So I like to play table tennis and traveling with the family, sir.
Great, great. You need to take out time for the whole balanced life.
Yes.
Good. So what is your message for the new upcoming dentist?
So dentistry, it's a profession which, if you're passionate about, there is tremendous scope and there is a lot of growth, provided, one has the right mindset.
Right. Great. It was good talking to you. Remain connected and grow as much as you can.
Thank you, sir. It was really a pleasure to meet you in person. Thank you.
Yeah.